stain right here. You ready? We're using a simple stain so that I can determine what shape the organism is. Because in this class, you're going to learn there are organisms that are round, and some of them that are rod-shaped, and some that are spiral-shaped. And I need to know this, because this will help me identify these organisms. And notice if I use one stain like crystal violet or methylene blue, notice I can clearly see that these are rod-shaped organisms, and that these two are probably diplotocci. They're round-shaped. Cornybacterium, they're supposed to be gram-positive rods, but they're very, very small rods. They're very short rods. So I'm not going to say they're diplotocci. So these are very small rods because of this organism here. Notice that I can clearly see that these are rod-shaped. You see that? So that's why we use a simple stain. I'm going to skip these for 2 seconds because those are the most fun. I'm going to come to these last. We'll talk about these next. Look at these special stains. Do you see why this one's called a flagellar stain? Do you clearly see the flagella on that organism?
Mm-hmm.
Would you like for me to tell you why this picture actually makes sense at the hospital? Ready? Because you're looking at this thinking, why do I need to know this? I'll tell you why right now. Woman comes in with a urinary tract infection. Okay? So you always do. I'm going to teach all of you all the questions you ask these patients before you give them anything. One of the questions I'm going to ask, besides, do you have any allergies? What medicines are you taking? Tell me about your primary physician and your history. Another thing I'm going to ask is, do you have any pain right back here?
Mm-hmm.
What am I pointing to back here? What are these?
Kidneys.
Right, because the bladder is not back there. Right? Where's the bladder?
In the front.
Right here.
Abdomen.
Of course she has pain in the bladder. Of course she has dysuria, pain and frequency urinating. And of course she's got discomfort. But I'm going to see if she's got any pain back here. Because you see, if the organism that's causing a UTI is motile, what does motile mean? If you don't know what motile means, I'm going to give you out in class. What does motile mean?
Movement.
It can swim. So if this organism is motile, that means it can swim up the, fill in the sentence for me. How does it get to the kidneys? How many of you had anatomy?
Oh.
The loop is in the filtration mechanism, and that's how blood gets filtered. How does